السلام عليكم ورحمة الله وبركاته. أهلا وسهلا. مرحبا. صباح الخير. Bonjour. Good morning, ladies and gentlemen, and welcome to the Middle East Healthtech Innovation Summit. Yesterday, we had the pre-conference investor forum, and perhaps, in my opinion, this was one of the best pre-conference sessions I have ever conducted in my entire career. We had it was a 9 to 3 event, but what really stood out was a 2.5 hour session that was dedicated to the startups for their live pitches that they had conducted to a panel of investors. And if you've watched the American reality TV series known as Shark Tank, we had a similar format yesterday. It was a panel in Shark Tank. They have a panel of investors, about 5 to 6 of them. And after every 5 or 6 minutes, 10 minutes, an entrepreneur would come, give an elevator pitch, and promote their product or promote their organization, because eventually they're pitching to investors. And the whole purpose of pitching to an investor is definitely for fundraising, for capital raising, and for all sorts of strategic alliances. There were some magnificent innovations that we had experienced yesterday during the startup session. And I'm particularly going to talk about MedTech and Claim.ai because we will be having a continued session from them later on today in the afternoon. We will, as I've said, we'll be hearing more from them later on today. In total, we had 8 startups yesterday across those 2.5 hour session. It was also supported by the Plug and Play Abu Dhabi. And most importantly, the League of Investors that was out over there. They had witnessed some of the most amazing presentations from these startups. And till the present moment, I am introducing and connecting the startups with the investors, and there's a lot of high demand. And a lot of high demand is what I've received. That we need to do such sessions in future as well. And if you attended the session yesterday, you would definitely understand how valuable it was, and I'm sure you would have enjoyed it. And those who missed it, well, you missed a wonderful session. From yesterday's event, we definitely realized that the practice is eventually becoming the new norm, and it is the power of digital evolution and the power of the digital innovation, which is revolutionizing the delivery of healthcare services worldwide. It's just not only in the Middle East, but it's a global thing. And most important, that is where the money is right now in. Investing in innovation, investing in digital transformation across the healthcare sector. Over the next 2 days, the conference is all about leveraging with technologies from the 4th industrial revolution to enhance access to healthcare for a patient's quality of life. To my entire speaker roster, I would like to thank you very much for your support in making the event happen. And I would like to extend my gratitude to our sponsors and partners for their support to ensure that the event happens. I would like to thank the ATC, Huawei, Rubrik, Claim.ai, Powerful Medical, MedTech, Ambify, MedCurator, Eventology, Plug and Play Abu Dhabi, Hub 71, the Swiss Business Council, the Council of Cooperative Health Insurance, the eHealth Development Association, the Middle East and North African Health Informatics Association, VR and AR Association, the European Institute for Innovation through Health Data, and the International Society for Chief Data Officers. This is indeed proceed with the next session. I did borrow 5 to 7 minutes from the next session, and my apologies for that, but we will be having a 55-minute discussion. It's called the CXO Inspiration Panel. And the theme is about preparing for a future-ready digital healthcare system. Are we future-ready for such a pandemic? And I've had the privilege to work with Mrs. Althea Davis. She is the managing partner and the chief data officer for Eventology, the supporting partner of this conference. She is also at the editorial board member of the Studio magazine, one of the partners of the conference, and she is also the country ambassador for the United Arab Emirates and a board member at the International Society of Chief Data Officers. The ISCDO is also one of the partners of the conference, and it's been a privilege to work with Mrs. Althea Davis over the last 7 to 8 months at various conferences. On the panel from Singapore, I have Dr. Adam Chi, the Chief Smart Health Leadership the Chief Executive for Smart Health Leadership Center at the Institute of System Science, National University of Singapore. I have Mr. Mohammed Fakri, the Chief Nursing Officer from Fakri University Hospital. I have from yesterday's session, we have MedTech's co-founder and the Chief Executive Officer, Tim Scholing. And we also have Dr. Najib Al-Shurbaji, the president and for the e-health development association based in Jordan. May I request Mr. Faki to also turn on his camera? And I would like to request Mrs. Althea Davis to take forward the conversation for the next 55 minutes, which is the CXO Inspirational Panel. Over to you, Althea.
Thank you. Good morning, everybody. Thank you very much, Fayed, and welcome to all of my panelists. Welcome, gentlemen, to the stage. I'm very happy that we're here together. And even though they stole a couple of minutes for that fascinating conversation with Dr. Shafi, I believe that we can definitely do a good job to fascinate the crowd. So welcome, everybody. Let's kick it off. I won't read the introductory paragraph, just to give all of you gentlemen a little bit more time to discuss and to share. So we're going to start off with, let's see, Mohammed Fakik. I believe, Mohammed, are you there? Maybe what I will do is I will move to the second question. And I am talking now to Adam. Welcome from Singapore. Adam, let's kick off with you. In order to facilitate the telemed health adoption, what are key considerations for a sustainable, resilient, and tech-driven future? Adam, please go ahead.
Right. So first thing first, fantastic question. I'm going to start off with the most basic is someone has to pay for it. Because I've come across so many solutions, implementations, great ideas that works on paper. But in reality, healthcare does cost money, and it costs a lot of money. So if you can't do prevention well, we're going to reactive care. Someone has to pay for it. It could be the governments. It could be the consumers themselves. And this will actually start off with a mindset change. So that's really the core basic. The second is the perception of care. Up to now, in various parts of the world, we still have patients, sometimes consumers, so they're not sick yet. They still have this perception that you can't get good quality care if you do not visit a hospital. I'm not even talking about a general practitioner. They want to go straight to the hospital and see a specialist for the most minor ailment that they have. So I can pay for it. I don't care. I'm just going to go straight to the hospital. I'm going to see a specialist for this little bump that I got. I can pay for it. And we have that in Singapore as well. From their perspective, they'll be like, what's the issue? I'm paying for whatever you're demanding. But in actual reality, they're overloading the system, and people really need care may not be necessary to be able to receive it. So that's important because healthcare comes in various levels. Some people are perfectly healthy, they just need a checked up. Health goes beyond the physical aspect. Sometimes it's really just someone to talk to. The mental health aspect that we're seeing so important in COVID times. So they have to get comfortable with the fact that they don't necessarily have to see the healthcare professional, be it a clinician, a nurse, allied health worker, right in front of them. So that's the second part. The third part is being smart about what you're using technology for. it is not utopia. There are some there are just some parts of it that technology as of today. I don't know about tomorrow or a decade from now, but as of today, there are many aspects of technology that are great if you know how to use it well in context, socially, culturally,
Right.
different aspects of things. So be smart about it. The reason why I chose to emphasize this point is I still get, and don't get me wrong, it's a positive thing. I still get clinicians who comes to me and says, Adam, we have everything right now. Can we do X, Y, Z? I says, yeah, I mean, in theory, yes. We send people to the moon. Yeah, we can do a lot of stuff, but you don't see people taking space shuttles for moon tours on a daily basis, do you? It's expensive. Yeah. So being smart about using technology. So if you get, this three part, being smart about using tech to address certain aspects, people accepting it, and that's actually payers, you actually get a great start. And we pivot from there, because the future is as they say, up to the sky.
Great.
Once you get people who are interested, then you move along and find out what's going on. Yeah.
Right. Well, thank you very much for that. I mean, it's really, really interesting what you shared. And I want to get a discussion going here. I'd like to start a riot. So I'm going to ask Dr. Najeb Al-Sharbeh. I'm sorry if I'm mispronouncing your name, Dr. Najeb. I see you smiling, so I got a smile out of you. That's good. I want to be devil's advocate. What you just said, people over stressing the system to go to the hospital for every little thing. I grew up in Canada, and in the Canadian medical culture, they encourage people to be proactive in the sense of preventing to have to pay for very high expensive medical care later on because they waited too long. So Dr. Najeb, can you give your perspective on what Adam just said?
Thank you very much indeed. Can you hear me?
Yes, I hear you perfectly.
Excellent. Yesterday there was a problem with my microphone, so I was not able to speak until the end when I used my mobile phone.
We'll make up here.
You see, we will make up, and that's a big issue that has been discussed with Adam actually. The question of affordability. I can afford to have two systems, a mobile phone and a computer. Hundreds of millions of other people cannot afford that. So affordability is one big issue actually that is facing the healthcare system, in which we see a lot of huge gap in terms of this group of people can afford and this group of people or individuals cannot afford. And affordability is one major issue. In terms of moving people from hospitals, the question of hospitals and hospitalization and all that was clearly stated by Adam, which I really think it's a great idea. I think it's coming anyway. In 2012, I think we had, when I was working for the WHO headquarters in Geneva, we had a joint conference with the International Telecommunication Union. And the motto that was actually used by WHO is H to H. H to H meaning actually the movement of physically of patients from home, from hospitals to home, which means actually don't use the hospital until and unless you are urgently needed. You need that. That requires actually a lot of self-care. It requires a lot of information on that. It requires a lot of telecommunication services, which means actually that you can do some work on yourself at home without having to move physically from home to hospital. It's the other way around. And that requires a lot of infrastructure, that requires a lot of regulations, that requires a lot of better understanding, because people think actually, that's very unfortunate. They only think actually of the healthcare system as something that caters for the diseased people, for people who are sick, while universal health coverage and the healthcare system in its totality actually takes care of the prevention and the protection and then treatment, the diagnosis, and all the other things that are relevant into the healthcare. So the question of actually not going to the hospital unless you have to is a valid one. And I think we should really encourage, and that's what many countries, including Jordan, actually over probably last year, they were telling people actually, don't go to the hospital, don't go, stay at home, and we will reach out to you. And if you go to the hospital, you are more likely to get infected. You are more likely to get sick because of other people. That is patient safety issue, and because of the crowd and because of so many other things. Of course, the intention was to keep people at home because of the embargo and because of the lockdown and all that. But from the medical perspective in particular, it's good actually to stay at home. And we know that actually the major healthcare provider to an individual is the family. It's not actually the, it starts with the family. What is your problem? Can you describe it to me? When did it start? Did you eat something? And the whole series of questions that pop up actually by the family, even before taking the individual to the hospital. And in many cases, the traditional medicine or just relax or something like that will take care of it. So I fully understand and I fully support the idea of actually hospitals are very important, but they are much less important if we do our job in terms of public health, in terms of protection and promotion, and using the technology to help us in doing that. And the technology, unfortunately, is very much misused in that particular thing. The emphasis of the technology is get sick, and then we will see what we can do for you. That's to me that's not good. So I'll stop here, but I'm sure the question and the discussion will lead to other issues. Thank you so much.
Thank you so much for adding and putting some fuel to the fire, because it's a very important discussion. And I just want to highlight what you said. It is a total ecosystem, and that ecosystem requires let's say, a layer of knowledge that flows freely among the different stakeholders inside the medical institutions and the informal, let's say, people and stakeholders. So I'm all about knowledge exchange. So thank you very much for highlighting that, Doctor. So now we're going to go back to Mohammed Faki, I think. Sorry about that. I wanted to ask you a question, Mohammed. It is the question about disease prevention versus applied improvisation. What is the best tactic to fine-tune your strategy?
Yeah, thank you for that question, and thanks everybody for attending. Well, I just want to mention something about the summit in general and the title of the summit, which is basically in the Middle East, right? And the focus is really Middle East. And we're here talking about some countries that even don't have the infrastructure for telehealth. We are discussing innovation, and we're discussing a lot of things that are related to innovation. However, we need to look into the infrastructure of each country. For example, do they have internet at home? That's something that we consider at this point in time is a privilege for all of us, and we have it by default. Whenever we are in a mall or we're at home, we're connected. But some countries don't even have that connection at home. Hence, developing the infrastructure of countries when it comes to telehealth, developing the home structure, and ensuring that they're connected, they're informed about these technologies is something to really start up with. Because if we start doing that, people will have more access and they will be more informed about innovation and technology. The other aspect that I want to tackle a little bit, and it's one of the lessons that we've learned from this pandemic, is we really were struck by the fact that when the pandemic happened, a lot of patients with chronic conditions stopped seeing their healthcare provider because they don't have access. And for example, like patients who are cardiac or diabetic on chronic medications, or they need to monitor their cardiac condition or monitor their metabolic condition. this is where the wearable devices came in place. And this is where this pandemic and what happened has taught us that remote monitoring, using technology to remotely monitor those type of patients who require monitoring at home through using wearable devices and using telemonitoring is extremely important. And I want to reiterate on the fact of shifting the hospital to home sort of concept and making sure that the patients are taken care of at point of care at their home rather than bringing them back to the hospital. Through definitely telehealth plays a very important role. Another aspect for that is telemonitoring, which is something I think the world can benefit a lot from developments along that. And now technology has the capacity, for example, for developing tele-ICU concepts where you can have a patient in Canada, for example, and being monitored from UAE or vice versa, alerts on a system that can really trigger some actions on a patient. So the other aspect is really telemonitoring. And then the third aspect, which is also I see very useful in terms of technology, is artificial intelligence in terms of checking, more like a symptom checker, where artificial intelligence can be utilized for a layperson or someone who is completely unaware of medical terminologies, where through a very simple questions that are supported by artificial intelligence, that app or that technology can really trigger the patient to seek to understand better what type of help they need to seek, whether it is that's a basic thing, you can stay at home, or you need to see urgently emergency physician, or you can schedule an appointment after some time. So these three aspects, in my opinion, are developing the infrastructure for underprivileged countries. And more awareness on telehealth, on that. Telemonitoring for chronic patients would really decrease the burden on the healthcare system and making sure that these patients are rendering better outcomes as well. And the third, using artificial intelligence in developing artificial intelligence more and encouraging its use and building trust and confidence in artificial intelligence among the mass public, to understand that they don't need to really talk to a healthcare professional to reach to a certain solution. They can talk to an app where it's probably having a much. So the way I see it is those three perspectives, especially when it comes to this part of the world, UAE and the Middle East. So I hope I answered your question.
Absolutely, absolutely. I mean, like you said, like I was asking about the two sides of the coin, it doesn't really have to be two sides. It's just one part of a total continuum. And as you put it, it's about addressing the bears on the road across the both areas. So improvision is, being able to, for example, like you said, people who are maybe less educated about healthcare and healthcare prevention, how some technologies, some knowledge and data management can assist with those things to make sure that people stay healthy. Thank you very much, Mohammed, for your answer on that. And I'm now going to go to our third question, and our third panelist. I think I can pronounce his name a little bit easier because I lived in Europe for many years. Timon Schürling. Good day. Welcome.
Hi.
Hi. Hello, Timon. How are you?
I'm fine. Thank you so much for being having me here.
Good. Grüß Gott. So when it comes to the technology advancement in managing such a pandemic, where in the region's healthcare sector positions, I'm going to reread that. Something went wrong there. Let me just do that again. When it comes to the technology advancement in managing such a pandemic, where is the region's healthcare sector positioned, and what can be done better? Timon, please go ahead.
Thank you for your question. And I would like to answer the question from the way that I compare the situation here a little bit with the situation in Germany. So when the pandemic comes, I think all over the world, it was like a little surprise for everybody. So for governments, for companies, for the population itself. So, and then people and all these organizations had to deal with this situation. And some regions maybe did it a little bit better. Some regions can do it better in the next time, I would say. And when we see it here, over here, I've perceived a higher technology level, or so that people are more open for technology. We have talked already about artificial intelligence, about open technology in general. And for example, in Germany, there's still that the health department works with all technology, like fax or paperwork even.
Yes.
So in my point of view, this is unbelievable. But of course, for using these technologies, we need data, and we need to be, all of us need to be open to share data, and that we are secure, of course, of the data is also important. But so this, I think, is a point, and I think in this region where we are here right now in UAE, there's maybe the pressure, or I perceived a higher degree of openness towards these technologies, towards sharing data. And so I think this is a point which is the basis for preventing those technologies in general. But then maybe we can also go over to not only digital technologies. So as being a startup from Germany, I would also like to talk about the openness regarding or towards technologies in general. So and towards innovation, because my core belief is that innovation can bring can occur during such pandemics, and can bring or can deliver a high degree on overcoming those diseases. And so we not only need an openness towards data and towards using new technology in this kind, we also need openness towards new innovation. So giving you an example, we have developed together with my grandfather and hand sanitizer on cold plasma basis. This is a completely new innovation that haven't existed before. So we don't use any drop of alcohol. We just use electricity, water, and ambient air to deliver a really high-class disinfection for hands, but also for other objectives.
Yes.
And so we had already a good clinical data, but of course, as a startup, maybe sometimes there are some papers maybe we have even to fulfill and bring later on. But so my wish is to give such innovations a chance, so that you can bring them also to the market, and to help people or help the society in this case to overcome the disease, because there are a lot of innovation out there, and a lot of young companies, startups, but that have ideas, and even that are able or that are ready for mass production, so to say. So my wish is to bring these products to the world, because then we can have a really good impact when we connect everything. We connect we have to connect big companies, for example, for the vaccination, for the organization of all this logistic challenges, because this is really important. But also we should connect startups and their ideas, and maybe we can also organize that we can help them together with also big companies, with the government. And also, of course, the scientific approach is really, really important, so that the scientists are also on the table. So it's my wish, so that we connect everybody, looking forward to overcome such diseases together, because together, I think it's always better than alone. And when everybody puts its efforts on the table, it can be go on. This is also my third point. When we are talking about, for example, hygiene, about rules, often, so I perceive that some rules are not really useful, and maybe even it's a little bit of actionism or alibi rules we have right now from governments, or in general from our society. So just an example, when we're going through Germany, there are sometimes supermarkets that disinfect trolleys with some spray, disinfectant spray, which is, in my point of view, not really useful, or even when you put some disinfectant in the air, normal alcohol-based disinfections just in the ambient air, it does not make any sense. So maybe we have even to make rules, or try to make rules that really make sense. So combine it, the thing, so openness towards data, openness towards digital technology, then openness towards innovation in general, towards startup, help them to bring their innovation to the market and to help the society. This is, in my point, is important. And third point, the exchange between politics, big companies and startups. And then, of course, just do it. I think this is the most important thing to overcome such diseases.
Thank you so much, Timon, for that. It's music to my ears. I mean, I lived the last 30 plus years in the Netherlands before I came to the UAE. And I think everybody has seen the pictures in the news about the riots in the Netherlands because of people totally just, losing it about restrictions from the government. And I think your point about knowledge exchange, that we sit down together and think about it before we start making legislations or re-legislating. I'm curious to hear also from the other panelists what they think about this particular, if we want to add to this, an answer to this question.
Maybe I can add one a good story towards what you were saying. So last week I was in Amsterdam. So there was an exhibition also for innovation, etc. We were there, and currently in Amsterdam there's a lockdown. So it means from 8 p.m. in the evening, everything is closed. Restaurants, bars, everything is really locked.
And it's called partial lockdown. It's called G2. G2. Or 2G.
Exactly. And my story is from 10 a.m. in the morning until 6 p.m. there was an exhibition, and this was just normal. It was talking to people, do a normal exhibition. And so, in my point of view, it doesn't make any sense to have those kinds of events in a normal day from 10 to 6, and after that, COVID comes, now we make a lockdown. So there, I think we have to think about it and rethink maybe, and so that we don't split the society.
But the point about data sharing and innovation, what you've said, and bringing people into the discussion, and knowledge should be more free flowing also to policymakers and legislators, is very, very important. And it shouldn't be locking people out, but it should be encouraging diversity in voices and opinions. I'm very curious to hear maybe from one of the other panelists if they would like to add, because I know this is a very hot topic. So please, gentlemen, go ahead.
If you allow me, I would like to share the UAE experience a little bit. I mean, I've been a resident of this country, beautiful country, for the past 2 years since the beginning of the pandemic. And the way the country handled this pandemic, I think, is really exemplary in UAE. And the way they have done the lockdown for a while, but then they partially started opening it up, paralleled with a mass vaccination campaign. What was really significant about UAE is the fact that the country was very transparent with the public, and they a lot of times they've involved the public in terms of taking the decisions of the country progress in terms of how this is going. And one very important and a clear thing that they have done is, you can be with the vaccine or against the vaccine, that's another story. But what they have done as a country, because this is again evidence-based as well, and what they have done, they have somehow enforced the vaccine, but not in a way where where you have to take it. They have put some restrictions on some areas where you cannot enter without having a clear PCR or a vaccine, for example. And this somehow encouraged the public to really go and take the vaccine. The other point that they have used, which was, I believe, very, very smart in here, is they used influencers also. So you would see a lot of people who are public figures are talking, for example, about vaccines and the effect of the vaccine and herd immunity. And these type of figures really influence the public in terms of encouraging everybody to listen to what the government is saying and what the DHA is saying. Set aside the command control center that was very solid that they have established in UAE, which really played a major role in managing the crisis at one point in time. So, and there's a lot of support for private-public partnership and at a government level. So that also contributed and helped a lot. I believe UAE is really one of the models that maybe similar to Singapore somehow. Those models should be taken and really studied well by WHO to see what went right, what went wrong, and see how can this model can be modeled in other countries as well in case such a pandemic arises in the future.
I want. Sorry, go ahead. Go ahead.
Thank you very much indeed. Now, listening to Dr. Al-Faqih and to Mr. Timon, number one, Dr. Faqih is very well dressed and for the occasion, so that's very nice. I think
it's a regular day at work, Dr. Najib, for me, and this is what I usually. I like bow ties. That's a signature, becoming a signature somehow.
No, probably I thought that you are thinking of a face-to-face conference. So, but anyway, that does not change the ideas. My idea is actually there is a huge difference between trusting and between being fearful. And the idea in Germany, for example, I do teach actually in Germany, and I have partnerships and all that. People within a state, they trust themselves, but between the states, they don't trust. You see? And that's why they don't share actually data, health data in particular, between different states. And Timon is nodding, agreeing, which is the case actually. The same thing with in Jordan, for example, like United Arab Emirates, like many other places. People do follow what the government is saying without necessarily trusting the government. It's just a requirement. You cannot enter this ministry. You cannot go to the hospital. You cannot go to the bank, actually. And at some point, you cannot go to buy bread from the bakery unless you have your mask. And now, of course, you have to show the certificate that you have taken the vaccine. And they introduced a law in Jordan, actually, on the 1st of October last month, saying that if you don't have the vaccine certificate or you don't have a 72-hour PCR, then you are not allowed to go. And hundreds of thousands of people still think that COVID is a story that was invented by somebody, and they don't want to get vaccinated. They don't want, but they say, well, we need to stamp this paper, so we have to go and pay for this, and we have to. So there is difference actually between the two. So I think the healthcare itself, whether we like it or not, it's more of a psychological attitude. It's about trust. I do trust this doctor. I do trust this institution. I do trust this community. So I tend to visit. I tend to consult. I tend to listen to, and that's where it's really important to make sure that we do develop that trust by evidence, by providing people with more transparency in what we do. I think what you have said, Eltia, is actually extremely important. Knowledge sharing and information sharing and sharing of data is a sign of actually self-confidence. It's a sign of go and check if you are interested. And that's where the open platforms are there. which means actually everything is open, everything is actually being verified by somebody else. So if you like it, you like it. If you don't like it, come back to me and revolt, or say something like I don't believe, I don't think, and something like that. So I think sharing is extremely important, and it is actually an important idea that we should do more of evidence to convince people that what we are doing is good, rather than forcing them to do that. And that's where in many countries, actually, including in Europe, Sweden, Norway, and all that, they never stopped. Actually, they said, well, let's do what we are supposed to do, and then leave it to the people to take care of themselves when it is COVID. So this is important, one thing. The other thing which was said, actually, I think it was said by Dr. Faqih again, about the internet and infrastructure, which I fully subscribe to that. Without the proper infrastructure at the national level, and important also at the institutional level, meaning a hospital, a healthcare center, it wouldn't be possible to claim that we are using artificial intelligence and blockchain and all this technology, electronic health record and all that. So we need to make sure that there is enough infrastructure. And Dr. Faqih was humble in saying it's a privilege. Actually, in some countries, it's a human right. It's part of the human rights to be, and they register that, and it's in their constitution and all that. And comparing, at least in the Middle East, we have categories of countries where the internet connection and the mobile phone, in some countries, it's over 100%, over 100. It's 1.3, which means actually that each individual has 2 mobiles or 2 numbers or 3 or whatever is there. Internet connection in Bahrain, in United Arab Emirates, in some of these countries, it is 100%, which means you are connected. Look at the Middle East countries, or the North Africa and Middle East. There are places actually which only 3% of the people have internet connection. If you take Somalia, if you take Iraq, if you take some of these places. So you cannot actually force a solution to a country without looking at the situation, whether it's infrastructure or otherwise. And I'm sure there will be discussion on the requirements for telehealth, which has been extremely useful and extremely beneficiary to people during the pandemic, whether it's a big country or a small country, or developed or not developed. People did refer actually to the use of information technology to get the vaccination, to get the advice, to get even medicine, especially that they are, especially those who are on chronic diseases, where they do renew the subscription or the prescription of a certain medication on a monthly basis or 2 monthly basis. And at least in Jordan, and I know that in many countries, it's possible to register, and then the pharmacy deliver to your place the medication if it's a regular thing. You don't have to go to the doctor. So all these issues actually have been really important in terms of wanting to use the technology. There is no way of that the technology is available, but I don't want to use it. It's not the case, actually. It's the appropriate technology that is good for my own health and my institution and my culture, and definitely it's good for my health as an outcome that I'm looking at. So I'm sure there will be other comments on that. Thank you.
Okay, thank you very much, gentlemen. I'm just looking at time because I want to give everybody time to jump into the next question, and I'm going to put Adam again in the lead on question number 4. So back to Singapore. Before I say that, I just wanted to say that I've been here in the UAE for the last 2 years, and I'm happy that I was here during the pandemic, opposed to other places. My family lives in the Netherlands, and I also have a stepson in Singapore. So I hear on a regular basis the comparison among those countries. It's quite interesting. So Adam, when it comes to the what are the best practices and methods to penetrate ways to overcome overwhelming sources of information that are affecting and putting pressure on the healthcare workers. So the, you know, the heroes and heroines.
Right, right. So this is a very important question, and one that is actively being looked at also by WHO. We call it, infodemic. So I guess the crux of the problem is semantic interpretation at times, because when you say something, it is subjected to interpretation based on your current knowledge and the context. So when you take the context away, and when there's a disparity in terms of current knowledge, it becomes very dangerous. Case in point, if I'm going to say, oh, I have a dog at home. Well, what is a dog? Is that like a German Shepherd or a toy poodle? What is it?
Yeah.
They're dogs. Are we talking about the same thing?
Right.
So you kind of see where the train of thought is. So before the context and the base knowledge, it becomes very dangerous. And that is something that's not easy to resolve in ancient time, because number one, people can actually spread misinformation deliberately. We're not even talking about innocent cases where people just share information. That's human nature. People can actually deliberately, spread
disinformation. Yeah,
people actually really do it.
Go into fake. We're just going to keep it at disinformation.
Yeah. So people actually do that.
Yeah.
So to really overcome that, number one, there should be trusted sources, sources of truth, if you will. And that is subjective again, because scientific literature is really up to interpretation.
Right.
That's why, for every research piece, you have actually looking at the data. It depends on your expertise, insights, and whatever, you can come up with different scientific discovery. So the same piece of information could be lying in front of you for the longest time. You don't see it, means you don't see it. Your colleague comes along, pick it up, and says, Eureka, I just connected the dots. So sources of truth is very subjective. You really have to have someone which is an established expert, and sometimes even established experts will have our own biases as well. So if you go back to the scientific parameter, actually for individual expertise, we rank it at the lowest. Must have peer review. Several people must actually look at the stuff and come to the general consensus. You don't have to be 100% consensus, but general consensus. Yes, this guy is not making it up. There's data that will prove it. So ideally, in a perfect world, we'll look to places like WHO. Or the governments, and these are all staffed by human beings, and we do make mistakes. So multiple factors that moving pieces that needs to be addressed here. So number one is, how do we regain trust from the population, that you trust these guys again, and also understand that scientific literature takes time to you need to get the data, interpret it, and scientists do make mistakes. So something to start. So with trusted sources, and there must be multiple trusted sources, because again, human biasness and what have you, and if things do correlate, chances are they make sense. And let's be frank, if the entire human population is drawing a conspiracy together, we're all doomed anyway. So you don't have to care about misinformation. But chances of that happening, I don't think so. All this conspiracy coming up is, world governments is all going to come out against us. No, seriously? I don't think so. But there are chances, like case in point, COVID situation, the disease. There's no data to work on. There's a lot of base assumption based on this pandemic, and that's how it is. And as scientists come along, get more data, they change their mind. And really, this is very normal in the scientific community. If you have one set of belief and you do not believe in data that keeps coming out, then there's something wrong with the researcher. So I guess really, reestablishing the trust. Understanding how scientific research work, and having multiple sources of truth. And I'll be honest, this is an uphill task. Anytime you deal with human beings, this is where it gets complicated. That's my take.
No, thank you very much for that. I just want to reiterate just a couple of key things that you said. So definitely, semantics, like you said, left to interpretation. But if you think about the factors, you said the person's knowledge, so let's just call it expertise because they're doctors. They're biased, right? The context which the information is being given. And then, like you said as well, human mistakes, either just inadvertent mistakes or intentional misleading. Building up that information upon information, so experiences. And of course, all of that with the volume of data. My question is the format, meaning that it's text. That seems to be also one of the particular pain points of the volume of this data, because it was tabular, it would be a lot easier to understand, or am I missing it?
It's tough. It's tough. I mean, we can put in all sort of visualization, but if you don't have the required knowledge to interpret it, it could be useless. So there's actually one particular example I found off the internet. I didn't invent this. It was a newspaper thing that says teenage pregnancy decreases once the lady reaches the age of 25. So teenage
25?
pregnancy.
Hey, I'm not a doctor and I spotted that.
So from a statistics perspective, absolutely makes sense. You can interpret the data. Yeah. From a contextual perspective, look at this. This is missing the bet. No matter what country you go to, the definition of a teenager will not exceed 25. No. But place this in the context of healthcare. We have all sorts of cases come here. Yeah. So
in the context of healthcare, it's defined as 18 and above. That's the United Nations. That's the United Nations definition of adolescence, at least.
Wow.
But I think the issue of semantic and syntax, which has been mentioned, semantic at least by Adam, and Althea mentioned the format. I think the interoperability between different systems and different ways of expressing what you are doing is extremely important, and that interoperability, that standardization is extremely important, because if it comes to semantic, I express my idea in this way, you might not understand it, or it is interpreted in a different context, which means actually that if you say children, what does it mean actually? When you say forced marriage, when you say the patient is suffering, what does that mean actually? He or she has a high temperature. What does that mean? There are standards actually to define that. So that's the semantic. And then of course there is the syntax, the way that you put it. And I think Althea mentioned actually having text versus having tables. Of course, now with the social media, with the media in general on the internet, there is multiplicity of format that is actually challenging to people. People actually see things even medical on the YouTube. We know of certain presidents actually tweeting on Twitter short messages like whatever is that. So we see graphic things being the same data being actually presented in different ways, which means actually if you are using big data, you have to have a multiplicity of format that you have to assemble and you have to analyze, so that you can come up with something that is meaningful to the people in the context of your particular healthcare system. And that is a huge challenge actually, because people do use standards, but not necessarily to the full extent of that, whether it's SNOMED or ICD-11 or whatever it is going for laboratory. But that actually leaves a huge room for discrepancy and for a gap between different countries, because of lack of access to these standards, lack of understanding of what it means, and so many other things actually. But I think the way that was put in terms of semantics and the examples that were put, I think they are very close to even people in the sort of audience, maybe they will understand the value of following certain standards in exchanging data and in talking and in presenting the diagnosis or whatever it is in the health and medical setting.
Thank you. And Mohammed, look, just talking about the UAE system or situation in the context of the UAE, what's your view of, you know, the Health Act and the Data, Health and Data Act, how that's being followed, or is it really just more on paper compared to the HIPAA Act in the US? Can you give us a little insight on that?
Well, generically speaking, in most of the countries, especially in the Middle East, again, is the fact of being comfortable on sharing data as well. This culture, to be honest, is not there in so many organizations, and a lot of organizations are even a little bit skeptical on sharing some data. However, in UAE, what happens here is the fact that there are a lot of data that has been shared or mandatory to be shared by hospitals to the regulator, which is the Dubai Healthcare Authority or Ministry of Health. And then also there was a data command center during the pandemic that was very helpful as well, where all the data were shared by the organizations and hospitals and through the command control center and the leadership of the country command control center, if I may say.
Yes.
So during the pandemic, I believe that was handled somehow in a very good way in terms of us as providers of care. We were fully informed of all the details and the numbers that they used to share. Some of it was not shared by public, but at least as a provider, they used to share those numbers with us. I mean, that's the Middle East or somehow the UAE sort of experience. But what I would really want to reiterate is the fact that I think in Europe and some places in the States, organizations are more comfortable sharing their data. You can even go on the website and see on that particular organization the hospital-acquired infection, for example, rates on that particular website. But then the maturity level in the Middle East is still not very mature enough to understand that this is part of sharing data is part of the provider responsibility as well, for the community. So I think that is an opportunity to improve when it comes to this part of the
country. Thank you so much, gentlemen. We have to quickly close, but we have one very important question from the audience. I'm going to read it out, and then you guys can fight about who's going to answer. There's a number of ways to describe virtual reality. This ranges from, I have never heard of this, so it does not exist in my place. It's a very long question. To it,
Althea, you're reading
this is the response of Dr. Najib.
Comment. Scroll above, the question is there.
I'm sorry, sorry.
I will read the question.
Go ahead.
The question is, we saw in the last presentation how virtual reality is used in the operation theater during a surgery in the UK. Now, how effective are virtual reality technologies being used in the Middle East, and how can such innovative digital techniques improve the lives of patients?
Thank you. Thank you. I was
I posted a short answer actually, because one can talk about virtual reality for a whole day, but generally speaking, virtual reality as an innovation, it's really good. The challenge is actually, where does it exist? Looking at the infrastructure, looking at the education of people, looking at the reality as we see it. In some places it might be there, but in other places it even does not exist, and people as patients never heard of that, especially in the less educated people and the many parts of the society. Now, in conclusion, I put actually that innovation is excellent. Innovation is good, fully supported, as long as there is enough skills to handle and there is infrastructure to do that. Now, when it comes to virtual reality, my thinking, at least seeing a number of examples and a number of applications of that, it's extremely good actually in learning and in sharing the experience, and in terms of actually showing people that it can be done in that way. And that has been done for the last probably 15 years. What was described actually as teaching people how to do operations inside the stomach, and the inserting certain camera and all that. So that was a form of virtual reality actually, because you cannot open up an individual stomach and say, well, this is how we look at that. So you have to send a camera with a small thing so that people can see and can watch if they want. Now, of course, virtual reality is actually imitating so many different things, and people get actually to learn to acquire skills for that. So that's how it is used. But I personally don't think it will actually replace the human being in learning and in teaching and in demonstrating and in showing what is good and what is right. It's a technology that is fantastic, but one has to be very careful about that. Of course, Dr. Faqih, as a hospital man, quote unquote, probably knows more than that. But my own observation is it's very good as an innovation, but it has to be used in a very, very specific situation where there is a need for that, not a need of the selling company. It's a need to resolve a problem that exists in the health setting. Thank you.
Thank you very much. Thank you, gentlemen.
Right. What I'll do is that I will actually copy paste Mr. Mohammed Faqih's comment that he shared on Zoom, and I'll share it on the platform so that people can know what is his views on the same question. But Althea, the panel, thank you very much. I have to take a hard stop here. We have
thank you, guys.
a very important session. We have Dr. Hamid Ali Al-Hashimi, the Digital Health Program Lead from the Department of Health, Abu Dhabi. And Dr. Hamid, we had his colleague, Mr. Professor Shafi Ahmed, who opened the conference earlier today in the morning. And yesterday, Dr. Dirk Richter was part of the Investor Forum, and he was chairing the Investor Forum. So Dr. Hamid will actually take you through the next 30 minutes on a very influential keynote presentation, which is about AI-powered integration. And it's all about transforming Abu Dhabi to be the world's best healthcare city. So I would like to request Dr. Hamid to take forward his presentation. Over to you, sir.
Yeah, thank you. Thank you. And pleasure to be here with you. And certainly this is an important session. And we all know digital health is important. And I will share with you what we are doing in Abu Dhabi, how we enable Abu Dhabi to become a pioneer, a leader when it comes into adoption and also contribution to the development of the right technology. I will start sharing my presentation. I'm not able to do it.
There is a green button or share screen. You can just roll over.
For some reason, this is not enabled.
So there's a, if you roll over onto your video screen, Dr. Ahmed, there is a green button called share screen.
Yeah, I've done that one. Yeah.
All right.
Yeah, I'm clicking it, but it's not really functioning well.
There's a firewall. I hope there's not a firewall issue at your
Yeah,
side.
I cannot do it.
All right. How about you email me your presentation right now, and I will do the screen share. And meanwhile, you can start the conversation, and I'll be sharing the screen. So just do send me your presentation right now on email, and I'll take it forward. Yeah.
Yeah, I did share it now.
Right. It is. If you can do me a favor, Dr. Hamid, on the Zoom chat, can you send me an attachment?
In the Zoom chat attachment.
Just send it to me as an attachment. I will share the screen. I would suggest that you can start the conversation. And just email me the presentation meanwhile. All right.
Yeah, I sent already to you the presentation. Maybe just speak it out and then. Okay.
Go ahead.
So it's a great pleasure to be here with you today. So I will be discussing with you what we are doing in Abu Dhabi when it comes to digital health and how we're making use of the data through different means. And the ultimate goal, the ultimate objective for us is basically how we are saving lives with data. And this is something that we have benefited a lot. We have demonstrated the benefit of data during the pandemic. And that was basically possible through the investment that we have done over the years when it comes to the data. And if we look at the healthcare in Abu Dhabi, okay, that's good. Thank you. If you go to the second slide, so we have evolved through the in Abu Dhabi through different phases. Initially, basically the last 10 or 15 years, we have been focusing on the infrastructure. Then we moved into focusing on the efficiency and the model of care. And what it matters for us as we coming into the future is really the digital health and the data. And we have seen from Professor Shafi in the beginning about how the sector is already evolving, and basically the future already here, as he mentioned, and that very significant. And in terms of digital health or the telehealth, the different solutions, not anymore as a concept or something that we wish to have, is actually being rolled out as we are speaking, and is going to be accelerated over the future. But what is important, and this is where the panelists also captured one of the panelists in the previous meeting, is about what we do with this technology. So it has to have a meaningful kind of a purpose in terms of having the right technology, the right solutions that will have an impact on the society, on the patient, especially, and how we are going to save lives with the data. Next slide. And we all aware about digital health. It is important, it is growing. And here, basically, we're giving a context about where we stand into digital health. And we see within the region, in the Middle East and the GCC countries, the adoption of technologies into the medical care or the model of care is increasing by 24%. And overall, globally, the market actually increasing by 26%. And for us as Department of Health, certainly there are many things happening around the technologies. And we wanted to focus on technology that matters, solutions that matters that will have the right impact. And we're looking at two dimensions. Where is the rate of innovations happening at a faster track? And what are the technologies and the solutions that are already being integrated with the existing model of care? And here we're capturing four main kind domain that we are addressing and we're focusing, which is how we are engaging patient with the data and the technologies, how we are going toward creating solutions to support decision making, clinical decision support, and how we're using data for basically different analysis, and then how we are using data to increase efficiencies within the system. Next slide. And when we speak about the digital, difficult to articulate what will be the future of the model of care, and it's really important, and we have this kind of debate. How are we looking at digital? Is it an extension of the care, or is it something, a parallel universe that is being created and is going to be shaped differently with its own kind of parameters, with its own kind of systems, procedures, and as well as policies and standards? And perhaps in the beginning, it is about how technologies are being integrated with the existing model of care, but we're coming at the stage where actually see that a model of care where digital and virtual care becomes a universe by itself, where many of the treatment, the diagnostic, and the engagement with the patient actually is going to be virtual. For that, we need to rethink about how we're looking about the future of model of care. And here, we need certainly to rethink different elements, parameters within the healthcare. We need to look at the infrastructure, the workforce, the governance, what will be the future role of the regulator when it comes of things are done, majority of the treatment and the care is going to be done virtually, and then as well as the financing element, the innovation and the research. However, we have to be clear about the value proposition. And in here, for Department of Health, and how we are articulating the value propositions into three main elements, tackling basically the value chain of care. So it's about how we making sure that our patient will stay healthy, and this is whatever is going on about the before people getting sick. So this is the engagement, the awareness and education, and other aspect that, and the gadgets and consumerization of health as well, and the diagnostic element, as well as how we sustaining their health. And what we seeing that there is a big opportunities when it comes to digital health. Solutions can be, and platform can be built to tackle kind of an end-to-end issue or a problem where technology can actually be enabled to provide these three value propositions in terms of the early kind of predictive model, the treatment, as well as the bringing care to home when it comes to sustaining their health. And this is how we are looking at the future, and how we are articulating the future model of care, where digital is going to be a centerpiece for change and transformation. The next slide. And another point, also good point raised by the panelists, it is all again about the infrastructure. And in Abu Dhabi, we invested a lot in terms of the infrastructure, how we are becoming ready for the future. Ready for the future, and what does it mean for us? And our thinking is about what will be the different platforms that we need to have in place so to enable this massive transformation for visual care and also for adoption of new technologies and new kind of treatment. So we're having 4 layers that we are building and actually start building it. So the first layer, which is about the data layer, and here we're bringing all the clinical records, we're bringing the pandemic data, at some stage we're bringing the genomics, as well as the other social determinant that we bringing them already into one platform, and that becomes more interesting case about having more a 360 or more holistic view about the patient, about the community, when it comes having a clarity, visibility about the health of the nation or the individual. The second platform that we are building, which is the analytical platform. Now, once we already have all of this massive data, it's not anymore, it's about having a dashboard or, 2 variables and kind of analysis. Actually, it's opened the horizon in terms of other kind of use cases where big data analytics and use of AI becomes an enabler. And we'll show you some of the cases that we already built and we already being rolled out. The other element, and this is how we are positioning Abu Dhabi as a pioneer or leader when it comes on the use of the data and the use of the technology. And we're creating what's called the Digital Innovation Sandbox. And we're bringing all the clinical record, de-identified as well, with the right privacy kind of protocols, so that data can be consumed within our own environment without data being exported outside. Whether for academia, for research, for clinical trials, as well as for collaboration with pharmaceutical companies. And that is already happening. The platform is being tested now. And that certainly will position Abu Dhabi rightly when it comes on different kind of collaboration, and including startups, on deploying their solutions, deploying their technologies, and making use of the data and start offering solutions. The 4th layer, and this to us is going to be a game changer for us, is once we have the data in one platform and we're having the analytical layer as well as the sandbox, then how we scale up and increase and make our the ecosystem more robust by creating a marketplace for solutions, for technologies on this platform. And what we call it the orchestrator. The thinking, the architect is being now articulated and being built. So assuming that a company having solutions and they want to interact with the whole patient, with the different providers or the different players within the ecosystem. So through this orchestrator platform, firms will be able to plug in or be onboarded in this platform, and then we'll have access to all the actors within the system and start offering services through this platform. And already one example is being rolled out and being experimented within the Department of Health. And certainly this will enable us to have a robust ecosystem that solutions will not be coming only from the regulator, but actually we're opening up the floor for different players, different actors to engage with us and building the future model of care for Abu Dhabi and also contributing to this knowledge globally. Next slide. The other aspect, so while we actually articulating and transforming the healthcare, we started already delivering. We started already executing and offering solutions that are based on data. They are enabled by data through predictive model, predictive analysis, machine learning. And here, this is a snapshot of the launchpad that we have been working on for the last 2 years. So we're having Malafi, which is I'm going to come and speak with it in detail. And then we're having also, instead of thinking about disease registries in terms of by each disease registry as a vertical by itself. We're creating a platform where all disease registries will be captured, will be analyzed using technology and AI into one platform. So we're working now into 14 disease registries. Hopefully this will be coming into an end by June of next year. And here, all this will also open the floor rather than analyzing a disease by itself. We are actually having a platform that we can analyze different diseases all together, and becomes an interesting case about how we look about these registries of the future, different as we are looking at it from now. During the pandemic, we created the pandemic response, and here we are able to bring different data sources, different data assets from Malafi, from also the financial claims, and for other sources from case management into one platform. So then the case management and the engagement with the patient, as well as the analysis, actually is happening within one platform. The next phase of this, and this is we're starting soon around it, is about if we are able, we built this pandemic response for one case, then how we are able, through the data asset that we have, predict the future pandemic or the future outbreak. And this is where we are heading in terms of about using the data that we have captured from Malafi and others. It becomes like a predictive model for predicting different outbreaks, different diseases that will become in the future. Another good case for applying AI, and this is where we already applied, is the population health management. So we already rolled out a predictive model for cardio, for diabetes. We're working now also for respiratory, and as well as for other chronic disease. So here, a whole platform is being built that will become at some stage as a decision support for facilities, for other actors, in terms of predicting the risk of a specific disease. But in here, we're looking at it from different modules that will be working together, applying AI, and a patient will step into a consultation room where the physician will do their own diagnosis as typical, but then they'll have additional support that will give them more insight about the patient, not about the risk, but as well as I mentioned, how we can bring other social determinant that normally the physician will not be aware of it. So about the nutrition, about the activities, about the engagement, about the patient with their consent as well. So this is also another use case that we are working on within the Department of Health. The marketplace, which I mentioned, and this is certainly is thinking that we are introducing, rather than we creating the solutions. Actually, other actors can engage with us and create the solution through the orchestrator platform. And this is will be, as I mentioned, we're looking forward to this solutions to marketplace to be created very soon, and that will open up different collaboration, different kind of engagement with different actors across the sector. The next slide will be just a snapshot about where we stand into Malafi. The next slide, please. And I see Dr. Rahul will speak after me. He can dig more into that aspect. Hello. So Malafi is one of the major investment that we have done, and one of the big success stories for Abu Dhabi. So we have been able to build Malafi within 3 years, and this is a record time globally. We have been able to connect all the facilities. Every single licensed facility, hospital, is already been connected through Malafi, and we have all the transactions are being captured. And this is a significant asset that take us into a different dimension when we apply AI and apply different technologies. As well, we're going to bring also the pharmacies and all the other actors within the Malafi program, hopefully by end of this year. So I'm sure Dr. Rahul will speak much more into this Malafi agenda. The next slide. And this is again for the orchestrator. We want our approach has been having agility and collaboration with the different actors to build the solutions and the technologies and the future of model of care. And this will be a platform by itself that will enable the creating a marketplace for the healthcare. And hopefully, maybe in the future, another very soon, within 6 months, we can give you more details about how this orchestrator is being evolved and the different solutions that we are already building. I will not be able to, because of the sake of time, dig into this. The last slide. Why we are doing all of that? First of all, we are doing all of that because of the assets. First of all, we are enabled having Malafi, we're having the claim data, we're having different data sources that position Abu Dhabi rightly as a leader when it comes on the digital health and becoming a hub for analytics as a service, as analytical solutions. And certainly the Sandbox, this will open up for different collaboration and positioning us as leader when it comes to technology and the adoption of technology. At the end, it is about why we're doing all of it. Basically, as I mentioned in the beginning of my presentation, is about technology that will help us to save lives, to make sure that our patients staying healthy, as well as recovering their health, sustaining their health, and introducing efficiency through the system. Thank you.
Thank you, Dr. Hamid. Thank you very much. It's actually good to be a tag team partner. There's a question popping up. There is one question over here. Let me take it. It's called, as Madhat has asked this question. It starts with a comment and then there's a question towards the end. Everybody strongly believes in prevention and remote patient consultation and monitoring, but most insurance companies still resist to pay for it. How can we move forward? So that's the question.
Yeah, so I think it's going to come, certainly. We have already articulating different use cases where prevention, for example, when it comes to mental health or other kind of diseases, how physicians can, for example, prescribe apps or different kind of activities, engagements, and being part of the insurance scheme. So maybe it's not now, but it's going to evolve. As I mentioned in the beginning of my talk, we need to think about the future of model of care or the digital health model of care differently. And certainly we need to come up with different model of financing, different model of kind of even policies and standard. So it's going to come. And certainly DH is leading this effort, and we're coordinating with different parties to make this as a reality. And hopefully this is going to be realized very soon.
That's great. I actually asked a question to Professor Shafi. He did show things about the potential of 3D printing in healthcare, and we did realize that 3D printing, it's in its infancy. Most important, the chemicals that are being used, that is health hazardous, and it's still like on the bottom of the pyramid. But so you are the chief artificial officer for DOH as well, at the same time as being the digital program leader as well. Having been born and brought up, and I've spent all of my time in the UAE. The UAE, when it comes to artificial intelligence, it is up there. That vision is phenomenal. All right. Now, in my audience, I have some I have some entrepreneurs as well. Yesterday, we had a lot of entrepreneurs, and we had a number of discussions based on artificial intelligence. So you would know exactly from a healthcare perspective, what is the UAE actually looking for, especially in the techniques that what does the UAE's healthcare artificial intelligence sector requires? So if you can list down 3 of the major components that you're looking for, that DOH and that the UAE government is ready to invest in artificial intelligence, and that is something which the startups should also take into consideration along with the hospital?
Yeah. So my advice is really just 1 minute.
Oh, no problem.
Yeah, sorry. So my advice.
Technology.
Yeah, they call me for another meeting. Sorry.
Go ahead.
Yeah. So it is for startups and for the community on the AI. It's about it has to be a problem focus. So we have seen different parties or different individuals. They have an idea that they want to explore and they want to work on it. I would rather focus on the problem, on the issues that we are facing. So it has to be a problem focus, so that making sure that for the regulator, for the healthcare, to have an impact on the patient, it is saving lives or addressing a specific issue, a specific problem. And this is the first step of it. And we should not think about technology for the sake of technology or because we are having a fantasy about AI. So it's all about a problem focus, and it has to be co-created, co-designed with either the facility or the regulator. And I think these two elements, will be much more as a driver for success for AI solutions.
No, great. Because we lost valuable time because of technology earlier during your session. But I want to take this one last question, which has come from Althea Davis. She's based in Abu Dhabi. She is the managing partner of an Abu Dhabi startup called Eventology. Her question is, do you aim to be a global data leader as well as a technology leader for world-class healthcare in Abu Dhabi, UH?
Definitely. This is our aim, it's our aspiration, and I think Abu Dhabi is well positioned and UAE into that arena. I think we are already a pioneer when it comes into having the data as a platform that can be capturing every transaction or the clinical records are being captured. We're creating the sandbox that will open up different collaboration globally. When it comes to technology, Department of Health with the Healthtech Hub, the collaboration with Hub 71 and other collaboration that we have on board, that definitely will help us create the ecosystem, the different actors within Abu Dhabi, and hence we getting into area where we being recognized as a hub for digital health and analytics.
Okay, so I know that the Skype is buzzing over there. They're calling you for another meeting, but we just popped. Oh my goodness, we have just we've got one more question from the same gentleman. Very robust ecosystem. Are you open to help other countries to learn and replicate such great initiatives?
Yes, yeah, definitely. And actually, during the COVID, we developed different solutions. We developed our own simulation model, for example, for the pandemic. We're now extending it to predict different disease, and the whole concept for us how to make this tool as a product that can be shared with other countries. We are developing the virtual care platform, and soon is going to be launched. And our aspiration as well, this product also can be offered to other countries as a collaboration kind of government-to-government support. And this is our aim, and leveraging all the solutions that we developed during COVID, as well as over the 2 years period. And if it is a use case that is applicable, that can be offered to other countries, definitely we will be looking at it.
I can be a witness to this because having spent all of my life in Abu Dhabi, I know Abu Dhabi, a great example is RDA, Abu Dhabi Investment Authority and Abu Dhabi Investment Council. The initiatives that they do outside the country, it's phenomenal. And DOH is also on the same footsteps, especially when it comes to delivery of healthcare services, not just in Abu Dhabi, but across its investment. Sir, thank you very much.
Thank you.
It was really a privilege having you with us. Thank you. Take care. And now we'll have your tag team partner